All right, moving on with our claims exercise. We're in the week 14 lesson plan. And this is our file, linking codes on claims. Download this. And on exam 4, I have 3 cases that are just like this that you're going to fill out. So I'm using this recording as my explanation for exam 4. That's the last question that you'll have. You'll have a document that looks just like this. And I have highlighted in the document what is being coded. And you're going to put the diagnosis and procedure codes on there to complete this portion of the claim. Because like I said, it's not too hard to put in an insurer's ID number, put in their, check what insurance they have, put in their demographical data. This is what is the most complex part of the claim form, I think, and what you need to have the most understanding of for this class as a medical coder. So we have a case study and then a part of the claims form that we're going to complete. Now, before I get started on this, I need to get my answer guide out. So I'm going to pull that up real quick. And I wasn't able to print these off, so I would like to have it with me on my while I'm here at the lecturing. But let's see, where did you go? Okay. So I need to pull this up for me, and now we shall proceed. So we downloaded our file. So if you're watching this recording at a later time, before you get started, be sure you download this right here, linking codes on claims. And what's good about this is those of you that are here with me now, you can rewatch this recording. So, okay, so our first case study that we have is from an emergency clinic. So we have a SOAP note. The patient was Benjamin Garland. The date was December 1st, 2019. Okay, this is what I'm looking at here. The subjective, patient's 44 male with severe pain in the lower right quadrant of abdomen. Medical record demonstrates expanded problem focus history and exam and moderate medical decision making. So that's the level of service that was provided, and this was an emergency department visit. So we are going to get to our E&M section of our CPT book, looking for this procedure. And also, we had a general health panel and an MRA, magnetic resonance angiography of the abdomen. So I'm highlighting specifically what you're going to look for to code. So that's why these are highlighted, bolded, and underlined. And that was in the objective portion, so that's part of the exam the physician was performing to treat this patient. And the assessment is acute appendicitis without peritonitis. So we have a pretty straightforward diagnosis. And I don't know if we have our ICD-10 books. We might have to wing this here, but that's okay. All right, so first things first, we need to look at the procedure, the procedures. We have an emergency department visit. So in your E&M section of your book, you need to find where emergency department codes begin. And let me turn to it myself. So I'm just going to pull up another document here. It's going to start at code 99281 is emergency services in E&M section. So that's the section we want to turn to. So turn to code 99281. So that starts in the beginning of the E&M section, a small section of codes, but these are billed quite frequently. So that code 99281 starts with our first lowest level of service. And we had a expanded problem focus history and exam and moderate medical decision making. So there is going to be a code. I would start at code 99285 and work my way back to see what matches that level. And the reason I would do that is I would want to try to capture the highest level that I could. But there is a code that is going to have an expanded problem focus history exam and moderate medical decision making. So take you a moment to determine this level of E&M service. And we should come to code 99283. So that's our first procedure code. So I'm going to bump up my zoom here. So looking at starting at box 24, this was December 1st, 2019. Okay, so I'm going to put in my dates here. I'm looking at 24, box 24. I'm going to put in my dates, and you don't have to type this in with me. It's probably better if you just watch for now, and you can maybe do this at home later. This was all in one day. The place of service code is, what was it for emergency? I need to pull up my, I'll pull up my link here. Is it 23? Emergency room hospital. Yes, ma'am. So I'm going to type in 23 there. Where it says CPT HCPCS, I'm going to click in this first box there. So for emergency, I will go ahead and just put a Y there for yes. On my CPT HCPCS code, I'm going to type in 99283. And this doesn't need any modifiers. You can have multiple modifiers, but it doesn't need any. The diagnosis pointer, I'm going to click in this first box here and put A. So we are going to put our diagnosis code up here in this first box. And charges, we're going to leave that blank. For days and units, I'm going to put in at 1. We just had 1 emergency department visit. Okay. So that's our first code. And the next thing's highlighted. We have a general health panel and an MRI. So this ties in well to what we covered today. We're covering laboratory coding and radiology coding. So a general health panel, let's look this up first. We're going to look this up. It's going to be an organ panel. We're going to learn what these are today. Okay. So for a general health panel, go to your CPT index and look up organ panel. And I do have an answer guide for this worksheet. I'll post this as a separate attachment for today. So if you want to practice in the blank one, that you can. And when you look up in the CPT index for organ panel, it's going to actually show organ or disease-oriented panel. And then we're looking for a general health panel. So again, that we're learning about these today. This isn't something that you would know. If you're not familiar with pathology, you wouldn't know what an organ panel is. So, and for general health panel, it does give us a code 80050. So then that would be my next code. Okay. So I'm going to come down here on line 2. And that was 80050. Don't need any modifiers. It's going to diagnosis A, which we're going to put in here in a moment. And we're going to have 1 unit. Now, it could be possible if this test is done 2 or 3 times, you probably would need a modifier to explain that on top of if you updated the days and units if you did 2 or 3 of 80050. You might need a modifier to explain if it was a repeat test. But luckily, we just had 1. So our next procedure was an MRA of the abdomen. So when you look up MRA, it's going to say C, magnetic resonance. I spelled that wrong. Resonance angiography. So this is of the vessels, the blood vessels of the abdomen. Okay. So go to your CPT index. We're going to look at magnetic resonance angiography. And it's of the abdomen. And that is going to give us code 74185. Now, of course, you do have to look these codes up to verify. I'm just skipping that's tips so we can get through the exercise. So 74185. I'm going to go back to my claim form here and put in my same date. These were all on the same date. Place of service was the emergency department, and that was 74185. It goes to diagnosis A. Whoops. And there was only 1 unit performed. So now we've got 3 procedures here, so we need to come up and fill this diagnosis code in. So I didn't have my ICD-10 book. I forgot that little detail since we're on CPT. I told you not to worry about bringing your books. I'm going to try this in the lookup on ICD-10 data. So our assessment was acute appendicitis with peritonitis. So I'm going to just type this in and then ICD-10 after it and see what K35.33. Now, this is not how I want you to get in the habit of coding, but let me double check my, okay, it's actually K35.80. Let's see what that one is. Acute appendicitis. So this code is showing with perforation and localized peritonitis, and that is what we don't want. So let me type that out specifically. Without peritonitis. Looks like it hits on the first one, and then here I've got K35.80, unspecified acute peritonitis. I think it was, yep, that's the code that we need. So the other one was with peritonitis. So let's say we looked that up in our ICD-10 book. Now we're going to put that diagnosis in here, K35.80, okay? So this claim, and we can have, it says up to 12 boxes for diagnosis here. If you happen to need more, you could insert a second page to the claim. If it's electronic, it doesn't really matter. When you get into billing pathology, sometimes you can get up to 10 and 12 codes of the procedures fairly easily. But this is how we would fill that out. So this person had the acute appendicitis. So their diagnosis is in that letter A there at the box 21. And this is their service, their procedures that was performed. So they had an emergency room visit. And we would list the first code that's listed is the one that has the most reimbursement, the most expense. And you can check these by provider. You know, at Medicare, you can look up what 99283 costs for the state of Kentucky or any other location in America. And that's another thing that we really touch on in the insurance class is how to find the monetary value assigned to these codes. But here we have 3 procedures tied into this one diagnosis code, and we're ready to submit this claim. I'm going to go down to the next exercise. There's 3 on this document. So the next emergency visit is for Benita Fawzi, and her subjective part, she is coming to the ER. Medical record demonstrates expanded problem-focused history and exam and moderate medical decision-making. I believe that's the same code. We have the same exact code as before, so that's good. Abdominal B-scan ultrasound indicates impacted gallstone. So we had an emergency department visit, and we had a ultrasound procedure. So we had 2 procedures. And our diagnosis was a gallstone. So I'm going to give you a moment to look up the ultrasound of the abdomen, okay? And we have the same exact ER visit as before. It's the same exact level, expanded problem-focused history and exam, and moderate medical decision-making. So we are looking at, we have our emergency department code. We're looking at the ultrasound. So when we're looking up ultrasound, we already know our emergency department code is same as what we used on the first case study. So looking at for abdomen and ultrasound, we get 76700 to 76706. Okay. So now we need to look up these codes. And we are going into our radiology section, which starts with the 700 number. So code 76700 is ultrasound abdominal. $76705 is limited. It's for single organ or quadrant, maybe like specifically the liver. 76706 is ultrasound of abdominal aorta. So the first code is going to be the correct one for us, abdominal ultrasound. So that's our second code after the ER visit. And for the diagnoses, I did another quick search on the ICD-10 data website. I highlighted my assessment. I come up here to do me a Google search, gallstone impacted, no obstruction, ICD-10. And it does give me the correct answer, K80.20. Of course, I do want you checking these in your book. So that's our one diagnosis, and we've got our two procedures. So what was that again? K80.20. So in box 21, diagnosis of nature of injury or illness. I have to keep looking at this. K80.20. Let me type it out correctly. Okay, that's our one diagnosis, and this data service was on December 17th, 2018. Okay, that's fine. These are just for practice. We can have a date in the past. I'm going to put in my dates there. Place of service, emergency room. I'm going to go ahead and put yes there. CPT code, our first one, 99283. That's the emergency department visit. And the medical record demonstrated it was expanded problem focused history and exam and moderate decision making. We don't need to put in any modifiers. I will make an exercise where we do that. I'll probably do that as a part of our survey review. And the diagnosis pointer is going to go to letter A. So procedures can be to different diagnoses on a claim. That can totally happen. And then days or units, I'm going to put in 1. The diagnosis pointer correlates with the box 21. So letter A there, where it says to go to letter A, it's going to K80.20. So it's indicating that's the diagnosis that supports that procedure. And it's possible to be, if you had more than one, you could do A, comma, B, comma, D. It's possible to have more than one, okay? And that's our first procedure. And then we have our ultrasound. That was 76700. So I'm going to fill this in. All right, and that's our claim for that at least our code linkage part. And I need to put my diagnosis pointer in there.
So you always have to have something on E, right?
Yes, you always have to have something on E. You can't have a procedure code that doesn't go to a diagnosis code. Absolutely. That's how it justifies the procedure. And like I said, it could be more than one. You can have more than one diagnosis pointer, but right now we're just keeping it simple. We're just going to focus on one. So, all right, that's our second case study. Let's look at the third one. Now, this one is an office. This is endocrinology, okay? We have a patient that was visited at home for type 1 diabetes with gangrene. And the medical record demonstrates expanded problem-focused history and exam and low medical decision-making. So we are now getting into home services of the E&M section. So I'm going to take a moment to find these here. So E&M home services, this starts codes 99341 to 99350. And that's, again, at the beginning of our book in the E&M section. So you can turn to code 99340 or 41, 99341. then the patient was for a regular check. So this is an established patient. So 99341 begins new patients. But since this was a regular check, we are going to go to 99347 for established patients. And we have an expanded problem focus, history, and exam. And what was the medical decision making? Low medical decision making. So you can start at code 99350 and work your way back to see which code meets the levels. And that is going to land right on 99348. So this code is for an established patient at home, expanded problem focus, history and exam, and low medical decision making. And on this one, we don't have any other procedures performed. And so, let's see, the date was August 11, 2018. So I'm going to put in my dates here. I'm looking at the procedure box 24 here. Let's see, what was that? 11th, 2018. All right, now our place of service is at the home. So I am going to look at my place of service codes again. Is it 12? Awesome. Good job. Yes, 12 is the home, okay? So we're going to put in a 12 right there. For our CPT code in that first box, we're going to type in 99348. And we're going to put a diagnosis pointer to A because this is where we're going to put the diagnosis for the type 1 diabetes with gangrene. Now, charges, we're going to leave that blank because, like I said, every office has different charges, so we won't necessarily get into that. Days or units, 1. We just had 1 home visit. So the line of service for the procedure is ready. Now we need to find this diagnosis. So I'm going to copy this from the assessment and come up here to do a search. And this gives me my code, which is correct, E10.52. Diabetes mellitus with peripheral angiopathy and gangrene. And that was E10.52. That goes into the diagnosis portion. So we got diagnosis there in letter A. And again, there's several letters here that these can be listed on. You can certainly have more than what's asked in this box here as well. Yeah, there's 12 boxes for diagnoses. It can go beyond 12 diagnosis codes. We have our dates of service and our place of service code, our procedure code, our diagnosis pointer, and our units that we bill. Okay, I'm going to close this for now. I will do some more review with this with our check-in video. And this is going to be what you see on exam 4. You're going to have 3 questions just like this. And I've highlighted in the document exactly what you're going to look for to bill. So it's not going to be anything too overwhelming. You're going to type in the boxes just like we did. Okay. But this is so important that we understand how this comes together, the billing aspect. So that's my review for now. I'm going to stop my recording.